Thank you for the introduction.
And welcome.
Thank you. It's been a couple of years since I was in Greece, and I'm happy to be back. And thank you for inviting me. Unfortunately, Brian, you're the chair, could not be here. I've been asked to come and report back from the Digital Health Conference in Tallinn. However, I wasn't there. But I will be able to, sorry, now the mic works. I'll be able to give you a background and the process of the Digital Health Society. But before doing that, I will introduce the eHealth Alliance. Just a few words. We are a non-profit organization. Today we have over 600 member organizations, which translates into over 16,000 experts. And what we do is we facilitate international multi-stakeholder connections around ecosystems that you mentioned. And we try to drive sustainable change in the delivery of health and social care. We are global. We have a presence in over 40 countries, mostly in Europe, but also in China, Canada, and the US. And the objective or the main aim of eHealth Alliance is to bring the needs and solutions together for the future of health. And the mission then, we provide knowledge and intelligence. We try to influence. We work closely with both the European Commission, local and regional governments around Europe to design public policies around strategies for digital health and so on. We connect and network, and I think that's our core activity really. We're joining the dots. Innovate, we support our members along the innovation process. Implement, scale up, communicate and disseminate. If you want to hear more about eHealth Alliance, there's a workshop tomorrow morning. I think it's called Building a Greek Ecosystem, where I'll be able to, well, tell you more about the network and alliance. But I was here to talk about the Digital Health Society. As you know, Estonia holds the current presidency of the EU, and one of their top priorities is the development of the digital single market and the digital economy in Europe. And of course, health and social care are also going through digital transformation, what we've heard before today. But one of their aims is to move forward the deployment and implementation of digital health across Europe. And to do this, the Ministry of Social Affairs in Estonia appointed eHealth Alliance as its strategic partner to develop the agenda and activities around the concept of a digital health society. And in order to do that, they launched a large collaborative work and ecosystem. So what is it then? There are three parts to the Digital Health Society. We have the declaration, the task forces, and the event, which took place earlier this week. The declaration, or the manifesto, expresses all the current main challenges for the digital health employment. And it highlights both the objectives and initiatives from each set of each category of stakeholders, to achieve it. The task forces, they've been created to move ahead tangibly with some of the challenges. So they've created action plans and commitments and calls for actions from all stakeholders to drive and actually move ahead to make the digital health society something concrete to work on. And the event then was to mark the launch of the Digital Health Society. I would say that, well, all the conclusions and reports were presented there. The declaration was signed in Tallinn. So if you look at it this way, the declaration kind of sets what are the problems, sets the challenges and objectives to overcome. Task forces come with the concrete actions, and the event launched the Digital Health Society, the concept of the Digital Health Society. This is just shortly to give you an idea of the timeline around the work. It started in July with an open consultation and everyone was invited to come in with their input for the declaration. And the consultation was open during the summer, open in July and closed in August. Parallel to this, the different task forces were set up and they started working on their action plans. And then the commitments have been worked on during the fall. The task forces have been working privately, in private, in close groups. And, the big signature signature of the declaration took place in Tallinn. So just some more information on the declaration. They received I've heard over 125 inputs from across Europe to the declaration. The latest version, actually, I don't know if you've seen have you seen the declaration? You have, yeah, I see some nods. Good. I'm not sure that this is correct, that the latest version was released on 10th of October, if that's the latest one. But anyway, the declaration, signed declaration is now out. So what is the declaration all about? It aims to co-build and co-sign, to be co-signed by all stakeholders to progress the digital health society. It expresses the main challenges, and they are lack of awareness and meaning, often by the citizens, of the benefit of the use of data, lack of interoperability. You need a convergence, both technically and semantically. There's a lack of clear legal framework. There's a lack of training for institutions, healthcare providers and professionals. Lack of confidence and trust. Lack of change management, strategy in healthcare. Some of these challenges have been talked about today. Lack of meaningful and integrated solutions. You have all these hip apps, but if they don't talk to each other, they're not connected and doesn't make a meaningful, integrated help. Lack of innovation in funding models. That's more talk about here about innovative procurement models. The signatories of the declaration will form a permanent group who will monitor and measure the progress together with the Commission. Moving on to the different task forces. There were 4 task forces set up in the summer. There's a 5th one underway, has not come as far yet as these. I usually say there are 4.5 task forces out there right now. The first one is on convergence, so convergence on interoperability standards, and it's led by Erik Gertsen from Ministry of Health in the Netherlands. And their main scope is to enhance cross-border exchanges of health data between the European regions and countries. And it will focus on identifying the ways of convergence in Europe. The second task force is citizen-controlled data governance and data donors. It's led by Angela Brands from Maastricht, also Holland. And they will map and review existing good practices or good governance models for citizen-owned controlled data. The third one looks at the legal framework for free flow and second use of health data. And it's led by Bled and Rees, digital health expert and lawyer. He's also an advisor and works with ECH Alliance. And the scope is to explore if it's possible to promote health and social care laws across 2 or more regions in order to promote the free flow. The fourth one is digital transformation and change management. And they will look at, it's led by Richard Corbridge in Ireland. And they will look at covering the adaptation of health and social care organizations, so how organizations can adapt and focus on the change management. Then the 5th one, which is not up there, is Cross-Country European Health Data Cooperation Network, which has been launched by the Danish Ministry of Health. And it will look at access to health data for secondary use. Well, here's the program for the Digital Society for Health, the conference that took place now a couple of days ago in Tallinn. And I would say, as I mentioned before, it marks the end of the preparatory phase and actually launches the Digital Health Society. Task forces are now open, and the declaration is open for signatories to join. I'll move ahead fast. So what's next? What I said, it's open. Organizations and individuals are invited to propose actions and projects. If you're interested in more information of the different task forces and looking at their action plans, I would advise you to go and look at the recent webinar. It's recorded webinar information where all the 5 actually task forces presented their work. There's also our Digital Health Society page on the Connector, ECH Alliance webpage, where you can find more information. And that's it. Thank you.